Ruto tutam.
Tutam ya matako zenyu.
Tutam ya mama yako.
Ruto na ile wimbo ya tupa. Shetani hata ni muhimu kuliko Ruto.
I am not a madman.
What? Hawa ni watu wako na akili kweli? Ni mafano.
Mimi si wazimu. Deputy President of Kenya and I am not a madman.
Hatukatai Ruto anafanya maendeleo. Hatukatai, lakini Ruto anafanya maendeleo na bei ya juu.
Ruto saa hii hata shetani yenyewe amemwacha afanye kazi Kenya. Shetani sasa anaenda huko nchi zingine. Hapa
huyu Pastor Dokas alikuwa anamuombea mpaka wanaongea in tongues.
Unajua uongo na ujinga hubamba mafala. Think. Wacha kuja tu kuongea hapo. Think.
Allah.
Nilisikia jamaa mwingine juzi amesema bahati mbaya akipata uongozi ati ata cancel SHA.
Omwami maliza uende. Hata nikiingia kwa ofisi na nitoe housing levy peke yake nishalipa deni yenu. Alafu nitoe hii ingine ya SHA nishalipa deni yenu. Nikipunguza mafuta kwa shilingi 5 every month, baada ya miezi 2 nimelipa deni yenu. Na namwambia asijam.
Nafikirisha is not working.
Because yesterday I got a phone call from a lady who was admitted in Nazarene. Immediately I called somebody and I said, this is the SHA number, this is the ID number. They are being detained because what happened is, and this is something we need to educate Kenyans, as soon as she was admitted, she signed up. But she...
Now we have the CEO here of Karen.
Somebody was alleging that Karen Hospital is complaining that they have not been paid by SHA.
Your Excellency, that is incorrect. Today...
So, Esther, please check your sources before you misinform the public.
Esther, do you want to contradict what Mandago said or yeah?
No, Your Excellency. SHA is working, but I...
What the fuck?
Dr. Gikonyo had tuned in and he mentioned it. So let me just read what he said.
Why don't you call him?
Oh, do you want me to call him? Okay.
Yes.
All right.
Put him on the line.
Yeah, I mean, what he said, are you aware that many hospitals have not been reimbursed?
Not many hospitals.
Okay.
We want...
and can you tell us how much SHA owes hospital services already, for services already provided? He felt that accountability for how much SHA owes...
No, you know,
yeah.
Let's not talk generalities.
Okay, let me just call him.
Call him, put him on the line, let him tell us. What is the experience in Karen Hospital? And I want my team here, you know. The thing we do not want is people making general statements. Many hospitals have not been reimbursed. Which ones? You know, it's good to be... Please, Mercy, do you have your data on Karen Hospital? Yes. Can we have Gikonyo on the line?
That's okay. Not answering. Maybe he's in theater.
Okay.
Esther Passaris, the woman representative of Nairobi County 047, aliweza kusema kuwa hata mseme nini ama mfanye nini, mjue Ruto ni tutam. Siko mnanipata hapa. Kama waliweza kupiga corona na wakaimaliza, sasa itakuwaje Ruto asikue tutam? Siko mnanipata hapa. Na vile mnajua anataka aenda wanie kiti cha UMP huko Makadara. Yes, sijui kama anajiangalia kama atapita. Yana anatakia mtu mwingine naye bado hajajiangalia. Siko mnanipata hapa. Itakuwa mbaya.
I'm currently sitting at a hospital and I genuinely need someone to explain SHA to me. Because what do you mean I'm expected to keep my account active every month, but when I actually need medical care, I'm only told it covers 3,000 for a bed. 3,000. And while we're at it, why does it feel like some healthcare services are designed for public servants in mind, while the rest of us are left to figure things out by ourselves? Because if citizens are paying in, shouldn't we be able to access meaningful services while we're sick? Every day we are told that systems are working. But let me tell you, if you're the one in a hospital bed, that's when you find out what working really means. And so today, I'm angry. I'm really angry. I'm so agitated actually. I'm mad.
Bwana President, ukitaka kujua kama SHA inafanya kazi, ulisa wananchi wenyewe wale wanatumia SHA. Wale wanajilipia. Mimi my annual subscription ni 12,000. Saizi unasema hospitali yote unaingia ukiwa kwa SHA ukiwa outpatient au ulipi chochote. Hiyo ni uongo. Kwanza hospitali mingi ukienda wanasema wanatafuta 07 peke yao. Sisi wenye tunajilipia tuko na shida. Umelipa na unaambiwa hiyo hapa hatuchukui. Utoke utafute mahali pengine. Na ukienda mahali pale wanachukua wanasema limiti yako ni shilingi 900. 500 ni ya consultation, hiyo ingine upewe Panadol na proven utoke. Haujafanya vipimo, haujafanya matibabu, haujatibiwa, hiyo peke yake. Alafu naambiwa unakuja hapa unasema kwa TV ya Kenya ya kwamba SHA inafanya kazi. Wale wanakudanganya, alafu nauliza mtu kama Mandako kusema SHA inafanya. Mandako anatumia SHA. Mandako hospitali gani yako na evidence ya kusema?
Hello guys. Speaking in my vocal, just speak in your mind. But right now, every Kenya need evidence. Or whatever you say, tell us with a supportive information. In the same way, we learned this in high school. You say something, a film, you give it a support. Watch this.
In other words, the two people who are involved in the healthcare system, the Kenyan citizen who deserves that NHIF, and the NHIF, so to speak, or SHA now, we are going to use the terminology we want, is supposed to provide their healthcare, cover their expenses. They are fine. They are innocent players here. The problem are all these people who've come to be entertained here. That is how you steal a nation. That is how NHIF and SHA have been used as elements of stealing from the Kenyan people, because we introduced the private players, people who are in it for profit. When we say nation capture, when we talk of privatization, when we say Kenya's healthcare has now been fully stolen, that there is no way of recovering, it is because of that. And in fact, we said the last gasp. Look at that video of the theft of the Kenyan healthcare is because now Ruto came and digitized it. And in digitizing, he added 2 elements that were not even in NHIF. And these are 2 elements of capture. Which means aliongeza wezi wakukula pesa zetu, so that this money is not directly from tax, the NHIF, the fund, to the people, to the patients. More people are eating. These are 2 people. One, the digital service providers. Previously, NHIF did not do that. But SHA now allows digital services to get in. Mtakuwa mnatibiwa na AI, na wanaitisha claims. There are a lot of them, real or imagined. Number 2, that digitization is the one that can instantly, through error, you saw what they did with the AI, be able to make those decisions on your behalf. Sure, you'll say everybody is doing that and it's going there, but this is the national fund for healthcare. So let me tell you who steals from NHIF or SHA, so that you can see the problem is not SHA. And the problem is not NHIF. The people who have been telling you the problem is SHA and NHIF are the people maybe at this moment don't have a place to eat. We will keep repeating this until you get it like gospel. SHA, NHIF, no, before SHA was NHIF. NHIF has been there since Moi said it in the late 90s. He said it because of...
My personal opinion about SHA, unfiltered information. Mimi niko kwa ground. SHA is not working on the streets, and that is perfect. But make sure you have your SHA and it is up to date. Healthcare is expensive. I see patients on a daily basis. Before I admit a patient, personally, I have to make sure that they have their SHA active and updated before they get in those wards. because it is unpredictable inside there. You get in just because of some sodium derangement. Tunaanza kupata imekuwa refractory, you have renal issues, probably you need dialysis at some point and everything. It becomes very expensive. You need advanced imaging, CT scan, MRIs and all that. It is very costly. You need a surgery at some point, wherever, be it a fracture, healthcare is expensive. If you don't want to have SHA, please find some alternative insurance that will work for you. And if you don't want insurance, make sure you can afford healthcare. For the sake of politics, let's keep it this way, that SHA is not working outside, but inside, make sure you have your SHA activated. Make sure if you have children, all of them are registered under your name. Nico Ground, and I can assure you that SHA is doing wonders for people who can actually not afford healthcare. People can now afford surgeries, people can afford admissions, people can get healthcare they want just because of SHA. Anytime I query anything to do with a possible malignancy, the first thing we do is SHA registration. Why? Because I want you to get healthcare to the end. Because tukianza series, biopsy samples and everything, tuanze kufanya histopathology, tuanze kufanya CT staging, CT head, CT chest, CT abdomen, pelvic. At some point, maybe you require an MRI for some reason. It is crazy. Most people who make noise actually have never been to hospitals, and praise God for that. We're wishing you well never to step a foot in those facilities. Because one day, if you ever step in that hospital for whatever reason be it, you will never, ever make noise about insurance. You will quietly go and register that SHA without anyone forcing you to register for it, because utakaa chini upige mahesabu. People are getting healthcare and support.
Na mahali amesema a new constitution that does not request us to consult the people, but mandatory. But it's mandatory. What does mandatory mean? It's a must. So the president anamaanisha it's a must they consult the people. Lakini si vile watu wanaiput ati vile wanaiput ati it's like it's not a must to consult the people. Let's have fair political criticism. Hii lazima niliitafuta nione. Mugala muwe lakini haki yake umpe.
Yo, hamkuniambia kumbe Musiri anakuanga na sisi kwa ground. Kumbe uko mtu wetu. Alisema ukweli, alisema ifikie Ruto hiyo message. Hebu isikie bala. Musiri salute Musiri hapo bana.
Waswahili usema mugala muue lakini haki yake umpe. Kuna statement president aliongea leo kuhusu the new constitution. Na hiyo statement inaenda viral, but the meaning watu wanaipata vibaya. Watu ni kama wanaielewa vibaya. Na nilisema lazima niitafute mpaka nisikie mwisho vile president alisema, because easy clips zenye zinawekwa short, sometimes they send a very different message. Mugala
President, what these people fail to tell you is that lower levels, it works well. When you now go to level 5, 6, patients are told to pay, especially on outpatient. It's not free. Someone is referred from a level 4 to a level 5, they are told to pay, or level 6. Mheshimiwa Rais, mimi ombi langu ni hili. Watu wakwambie ukweli. You had a good plan through SHA. But for a common mwananchi who is not working, or who is working in the private sector, especially those low-income earners, when they go to level 5, level 6 facilities, the hospital management, those people are sabotaging SHA. Level 5 facilities across the country, management is sabotaging SHA from not working. People are forced to pay. Let's call a spade and not a big spoon. And even I don't speak on behalf of the 54 million Kenyans. Nobody will do it. Mr. President, you had a good presentation. But what these people failed to tell you, especially the CEOs of the hospitals, those who are running this SHA, shida ni moja. Haya nitumie Kiswahili. Mheshimiwa Rais, watu wamekataa kuambia ukweli. Level 5, level 6 and some level 4s, watu wanaambiwa walipe pesa. Wanaambiwa SHA itakusaidia kwa
He's like, what NHIF ibaki, but it was now defunct. By defunding it meant the decisions of health insurance were given to private. Aki and Kepsa, those are the people, the insurance firms, and then they went and opened theirs, and then they started getting investors to come and do the hospitals and private hospitals, and then the mission hospitals started doing groups of hospitals. You saw them opening branches. That's what they did, because they knew now finally the money was going to come to them. In fact, those hospitals and the private insurance will tell you, because now that is how they were eating from NHIF. They send this claim so that they get more money, capital, because now it was clients. So the exaggerated clients. So the people stealing your SHA, your NHIF, is not the government. It is the people in those private hospitals. It is the private hospitals. Those are the thieves. One category of the thieves, but those are the thieves. Number one. So, and of course the private insurance, because now they get our money, add whatever, and then dictate where to go to be treated. They don't tell you to go to public, no. They tell you must exhaust your NHIF, but they fund private. And it's always the same people. You find previously, AR was giving insurance, and they also had the hospitals. It was an incestuous relationship they had established. You think MPs are a problem with CDF? Hospital is fully stolen. Then, Uhuru Kenyatta comes. People are like, let's put counties so that it can be offered on the ground. Uhuru Kenyatta defunds them. In a way, no money is going. So now the workers start leaving. They leave because they are not paid. Salaries are delayed. Right now, healthcare workers are on strike. I told you there is no hope. Because after they are defunded, a lot of some go, not a lot, about 12, a lot. But they have been going now since 2020. Because that's all they designed. Now look at the beneficiaries here. The private investor
saidia kwa inpatient. Outpatient unalipia. Outpatient people are paying for SHA. Watu wanajilipia outpatient SHA, Mr. President. Nimeona umefanya presentation mzuri. Amazing things you have told Kenyans, but what these people are not telling you is that level 5, level 6 common mwananchi wanalipa. Wanaambiwa wanalipa. Na hao ndio wanafanya ionekane kwamba SHA haifanyi. Wengine wanasingizia kwamba SHA reimbursement inachelewa. In a real sense, they also have a problem in submitting their claims. Watu wanateseka. Wananchi wanateseka, Mr. President. If they have not told you, just send 3-5 people to level 5, level 6 facilities, outpatient, wakweli referred from level 4s. They'll not get service. They'll be told to pay cash. Watu wanaambiwa walipe. Inpatient nayo inawasimamia, although kuna wale wanaambiwa waongezee, but people should tell you the truth. Otherwise, SHA is working for civil servants